I'm Helen. I'm a GP in Lewis, and well, I'll tell you a bit about me. But apologies first, because I'm used to talking to people one at a time or a family at a time, not giving talks. So I'll try and keep to time. I can stop if I run over. I'm certainly not used to PowerPoints either. So firstly, I was going to say, what's my qualification for being here? I've been a GP partner in Lewis for 20 years, and I'm mental health lead for the primary care network. So in Lewis, we're a single practice primary care network, which works well, I think. And at the moment, I'm following a NHS mental health leadership fellowship. I was brought up here, so I've lived here since I was 6 years old, and then I live here as well. So, and I've got 6 kids, and they all go to local comprehensive school, well, primary and comprehensive schools. So I guess I'm bringing the experience of the community, as well as my experience. I get to see where things don't work. I get to see a snippet of it and a snapshot of it. I think I get to head into the school gates, I get to bump into people of all different ages in the street. I can't really go to the supermarket efficiently. I can't do anything much efficiently. And then I get the privilege of just walking out people's homes, being with them as they die, being with them when they're born, and everything in between, being with them when they're breakdowns, all of it. So that's quite special and relatively unusual, old-fashioned general practice. So we're obviously hoping to build, I'm planning towards building a health hub. That's one aspect. We've heard about specific individual buildings this morning, and I think we've got some primary care and some secondary care. I just wanted to bring a few thoughts, a few bullet points, I guess, of thoughts. It's hard to go into much in depth in the short time we've got here, but maybe it'll spur things on. So the main thing that for me is how we integrate health and wellbeing in the community through the judicious use of buildings. First, our Times Health Hub, but then all the spokes going out from that. Because in primary care, we've got a population of 30,000 we're serving, and that's not, you can't, well, it wouldn't be right anyway, it wouldn't be healthy to have more in one building, and I would argue it'd be impossible to have one building with many needs. So we need spokes going out, and there are ways to do the actual structure and how the buildings work that will make it greener. I think in terms of some of the views of buildings in the past, or some of the buildings that have been briefly spoken about, views of buildings, are not clinician-led by and large. They may be rushed clinician-led, into like going up and downs, when unfortunately we've got some see patients too quickly, and then they're driven by that kind of ethos, wearing gowns. But largely, most clinicians I know want patients out in the community, being looked after. We try and avoid them being looked after at the right people, by the right place, in the right way, and frequently avoiding medical intervention altogether. So I'm going to move on. Okay, so Jason, my partner, penned down a few thoughts about how we know what our community really needs. Physical and mental well-being, the integral, social prescribing being key. Social prescribing being key, hub models, reducing the environmental cost of healthcare, and working in partnership with patients and the community, and getting the basics right. I'll take you through a few points. So firstly, it's essential, I know some of this will be obvious, but that we retain it being person-centred. So that's not a simple matter. We need to question everything. What would that individual need? What would they want? And to find that out it's not a simple matter, because the people we're talking about, many of them won't have open voices. So the teenagers may not be heard, and there's huge need now. The elderly may not be heard, the poor will not be heard, and you've probably heard of the inverse care law of Tudor Hart, that the principle that favoured good medical or social care tends to vary inversely with the needs of the population. So I see that in practice and have done throughout my working life. So that's a challenge, to make sure that we get their voices. I've seen it sometimes done as a kind of token gesture. We have that person with lived experience. But I think we need to really scrutinise at the outset, design, and throughout how that building and the associated services respond throughout its lifetime. So, yeah, I can't emphasise how much we need to be brutal with ourselves and scrutinise ourselves as we develop services and buildings to serve those needs, and make sure we access those voices, go to people, pay them for their time if necessary, and make sure we really get those voices heard from people who are not speaking up, who not normally get to meetings, who are struggling. Timing, well, we need it now, we needed it yesterday, we needed it 2 years ago, not just in terms of building, but in terms of all the services being approved and the group of buildings around. So the tragedy I've seen in mental health is there's been next to nothing done. Sorry, I get a bit angry at that. But it's just quite shocking to me how little extra mental health provision there's been by this government. I would not have been able to believe that at the beginning of COVID, but 2 years on there's been so little provided. And obviously mental health is inextricably bound with physical health and both impact on the other. So we need to do it ourselves, because there's a lot of talk, but as far as I can see, there's no action coming through. So it's down to us as architects and as a community to do it. So timing, I think, yeah, in terms of driven by need and recognition of the urgency and the limitation of resources, but they're not forthcoming from this government now. And I've been a bit of a fan of pilots over the years, but I think I've come to reconsider that and think we need to launch it but review. So a small scale can look good, but not look so good if it's alongside the recognition of its only meeting a proportion of 2% of the population, for example. So I would say we need to be bold based on a solid evidence base of what the needs are and what the range of buildings can deliver and support, move forward at scale, in a big way, and with continued review that it is meeting what we thought it would do. So my point, saying now is scale. So we need to actually scrutinise whatever build, whatever services we offer, to check that actually meet the needs of the vulnerable and of the volume of the population, not just a small subgroup. So in terms of physical space, I think no one building is going to fit the need. So we can build our health hub, which is great, and it's good to have loads under one roof. But in terms of what I would perceive as a need, it's that in terms of having outdoor space, incorporating community gardens, incorporating environments where one can learn to work, where one can learn new hobbies and connect with others. We need to see it as a spoke and a hub that connects. And we need to involve the whole compassionate community, so look to them to aid us, to advise us and provide. And then there's potential for bringing things out of hospitals, like visiting clinical specialists in the community to look at mental health. It'd be great to see our mental health consultants being able to come into the buildings, rather than patients having to go up to these remote buildings, which is typically tricky for them. So, anyways, there's lots of examples of diabetes similarly. There's moves, but that would be great to see those in the building. Obviously, it needs to be sustainable long term and responsive to evolving needs and possibilities, and connecting with current services and ready to connect with new services. So I was going to talk, there's a couple more points before I go on to this. I've been thinking a lot about the lack of leadership, or the barriers to leadership around, and the limitations of NHS leadership, let alone political leadership. And usually these people are away from patients. They're not living in the community, and many times they're not experiencing the same NHS needs. So most of our politicians will have special wings. Even if they go to an NHS hospital, they're special beds. They don't have the usual bed. if they have to go in. They don't go through the usual routes through aiming. So they're really limited in what they do. Our health sector doesn't have much experience of health. So, you know, it's, I mean, that's not just as a statement, it's just fact. You haven't got much experience. So they're really limited, and I think maybe we need to have confidence to lead from the ground up, is what I'm saying, from the community, from patients, and from clinicians dealing directly with them, along with people who are building buildings. We all need to work together and realise the limitations of the people who are making rules and work around that. And then lastly, we need to have a focus on the right treatment and care. We need a building that facilitates a building or a cluster or a group or a hub building with spokes and many buildings, areas of land beyond that, that will facilitate the right treatment and care, the right person at the right time. So when we talk about green things, there's a whole range of other green aspects of building which I'm not sure, well, I don't know if it's going to be referred to in this, but for example, you're talking about inhalers. So if we facilitate right medical care for people, we'll get them on right inhalers. And then they won't be using the really high CFC producing inhalers, which are the relievers. So if we have them on the preventers, if we're making sure we're going out and getting people and enabling them to access us, enabling timely care, then we can avoid that. Similarly with mental health, if we're providing the right care in the community, they may never need drugs, or they may be able to get off them quickly, more quickly. Some people will receive medication, that's the right thing for them. But rushed, pressured, unsupported care means more medication. It also means avoidance of timely medication even then. So it means we know if we have diabetes suboptimally treated, people are more likely to end up landing in hospital, in ITU, and that's not green, and also not good for the person. So if a building can facilitate good holistic medical care, then that in itself will be green, quite apart from the substance of the building itself. So just 3 examples, and I'm going to be brief and wrap up because we talk about this all day, and there's many, many more examples. But Canterbury in New Zealand, they took huge change in their healthcare. Not so much, well, they did think about buildings, but it was more about structure. And so what I want to take from this is they looked at having a shared vision and a shared purpose. From that, they drew 3 strategic goals. So the shared vision and shared purpose was what does that person need? And they took a person and called her Agnes, and at each stage of development, they would say, what would Agnes want? What would she need? And this brought together loads of disparate groups that were fighting for funding, fighting for views. Secondary care was very much, this is our boundaries. We don't want our budget based on this. Primary care, similarly, it took a long time. There were many more layers, more complexity that they went forward on. But they started with that shared purpose, and oddly, along with saying, what would this one person want? And pulling out of this and questioning everything. Their central shared purpose that they agreed on together as a community was not to waste the patient's time. Which might sound like a small thing, but actually if you're enabling them to not have to go into hospital, you're not wasting their precious time of their life. If you're enabling them to die at home, if you're enabling them not to have to wait for an appointment. And then that moved on to not wasting the clinician's time. And that was based on an analysis of how short they were going to be of health staff in time to come, which is certainly a crisis over here. And I would say we need to look at that and not wasting clinicians' time. It should be a win-win. This could be a virtuous cycle. If we're having people coming to, if we're having a building and series of spokes going right from that facilitate healthy, holistic, not over-medicalised, using medicines as the last option because it's quick, that's proactive rather than reactive, then we won't be wasting clinician time so much, and we'll be doing things in a more timely way and more green way for patients. So, and then they led down to 3 goals, which we're going to in depth, but then they could question all their activities. But the core thing was they took everyone together, so they had to find ways to coordinate health and social care, communities, charitable groups, benefactors. So So I think that's a challenge I want to put to this group, is that myself as GP, I'm just a GP now, and if I go and get involved in leadership, anything like this in a big way, then I have to leave my patients and that direct care. So probably not for me to do in this time when we've got doctors. But we need to look to someone to step up and coordinate and work together and work as a team. Really help. And they've got a health centre urgency. And that's just a pictogram really of the person in the centre and all these different facilities working out from the patient. Okay. So then you probably all heard of Rome, Sunset and Compassionate Communities. So that was a community-based service. The reason I wanted to refer to that was that, again, it's multi-agency. It proved a substantial decrease in A&E admissions, which again is really and good for the patient. And so by involving the whole community in a series of holistic support, they were able to avoid so much medicalisation and avoid hospital admissions, plus it was better for the patient. Sorry, it's not showing up that well. Again, echoes the thing that I'm now repeating myself over. Bromley by Bow, this is just the home services page of their website, which we plan to incorporate at Foundry. And my point of this is, I don't know if you can see from the back, but you go into the services and there's a page of options, health and wellbeing, looking for work or training, get helpful advice, learn new skills, enjoy our spaces, adult social care, make new friends, start a new business, activities, sports and groups. And I would like to see health and wellbeing just being one option. You go on and you see, actually what I need is I need new friends, or I need activities and sports, or I need to get a job, or I need some skills for an occupation, or I need help in social care. I didn't really need medicine at all. So that it's just one of a group of other options, and we're dealing with people the same as a whole person. And it's nothing new. I mean, doctors have been talking about this, certainly, well, Prince Florence Nightingale, and certainly all my working career, but maybe out of the crisis of the workforce, we can actually provide better care, because we can't sustain it with clinicians, nor should we ever have. So if we can build something good like this, actually maybe it'll be better. And so I think looking to our community, we'd love to have a building where there were hubs, or where that was focused, where it was a place where we could link things up. And I'd encourage people to look at the expertise in our community around. I was going to invite someone along, but didn't manage to get together. But just one small example, there's a farm in Kingston, and they just want to open it up for health and wellbeing work. They're living very humbly in a small, they've got huge amount of experience and business expertise, and have done all sorts of health and wellbeing work before. But there will be, and they just want to work with people in funding and support health and wellbeing, farming, growth for the community in a not profit way. So I think that there'll be many sources around like that I don't know about, and we need to find ways to draw them together so that it's not only having a building, but grows well beyond that. It's a building that's utterly connected with the community and with all it's got to offer.
Thank you.